welcome to the Sextant. I'm Ben.
I'm also Ben.
Today we're going to be talking about an important subject, breast cancer.
So breast cancer is a pretty important topic to me because my mom had it for a couple years.
Oh yeah?
And luckily my sisters never had it, or my grandma, but we had to go through, my mom had been to have chemotherapy and other things to try to get rid of it. Luckily she's went into remission and she hasn't had it since.
Yeah, that's good. Yeah, I personally don't know too much about this subject just because, it's never affected anyone personally to me, and I've never had it come up very much, but I do find all this stuff that we've been researching on very interesting, and whenever I do hear someone has cancer, I personally would, I want to do all I can to help them, and so that's why it's really important that we research and fund these things that are helping people who have it.
Now, researching, there has been a lot of research done lately on breast cancer, and one of the biggest things they found out was the reasons people get breast cancer. People used to think it was just genetics, which in my family that would have meant that my grandma probably would have had it and then my sisters probably would have had it. They found out it's not so. There was more environmental and lifestyle factors that influence one's obtaining breast cancer, like weight gain, weight loss, even changes in your diet.
So, by trying to change these things, you're not only going to help prevent cancer, but it helps you just, as a person in general with your, health choices, right? So,
pretty much exercise, eat healthy, just like everyone's been telling you all your life.
Yeah, so...
Good ways to not get cancer.
That's pretty cool. Yeah, and also I was reading that by diagnosing the tumor cells that fall off into the bloodstream, they can see by doing blood tests that if you have it. And I know that even though that's a good way to tell, it's not a good way to prevent the cancer still. So, but they're going to try to see if they can fix something about that, which is, I think that's pretty cool. Who would have thought just by doing some blood tests you can figure that stuff out?
See, now I never knew that cancer cells would fall off tumors.
Yeah, neither did I. So it's kind of scary when you think about it. Kind of sounds like a sci-fi, different cells going through the bloodstream. But it's still, scientists and doctors are trying their best to help out everyone who has it. So
now, things that are helping, there are coming out with new cures for breast cancer. There are new radiation treatments that take less time and are more powerful. So they've been shown so far to be more effective in treating breast cancer than the older techniques of radiation therapy.
Oh.
There's also this new drug called the PARB inhibitor, which is geared towards people who have gotten prostate or ovarian cancer because of their breast cancer, or maybe their breast cancer just isn't stopped by other treatments.
So it helps with everything in the long haul, not just this one specific type of cancer.
And right now it's going through clinical trials, so it's not on the market yet. Yeah. But if the clinical trials go well, this is a new treatment, so they don't have to pump your body full of radiation.
Do we have any statistics on how well that indicator is working?
They haven't been releasing any of it yet. Okay. All they've said is it's promising.
Oh, well, that'd be cool if it ended up working out.
There was another study that was saying that women who have breast cancer have lower vitamin D levels than other women. So there was a theory that maybe if you consumed more vitamin D, you would be less likely to have cancer, but there is no actual factual evidence to back that up.
So even if we tell everyone to take their vitamins, there's no promise that it could help? Oh, okay. But, yeah, and another interesting thing is even though, we kind of touch a lot about on how women have breast cancer, that we found that men have a likely chance of getting it too. Not as much. It says here that breast cancer is 100 times less common in men than it is in women, but that's still 1 in 1,000. So there's about, you'd say, 2,000 people on campus. So that's 2 men out of everyone here that's on campus. That's kind of crazy.
Could be me and you.
Could be me and you.
That's a very scary thought, actually.
Yeah.
Okay, on to another subject. There is a movement going on called Think Pink, Live Green.
Oh yeah?
Which is really cool. And it's very eco-friendly, environmentally friendly, what they're doing is taking survivors of breast cancer and teaching them how to live healthier lifestyles, which a lot of it is, again, living more healthy that would also help the planet. And it's been effective for many women to not go out of remission.
Yeah.
So their cancer has been staying away because of their changes in their lifestyle.
Oh,
which is pretty cool.
Yeah, that's kind of cool, actually, because that goes back to what we talk about, exercising, eating healthy. So by also, like, just living your life the best you can, like, you know, respecting the environment and, like, eating healthy and exercising, not only are you preventing cancer, but you're just, like, helping just society as a whole when you think about it.
Mm-hmm. So I think one of the biggest issues with breast cancer is a lot of people don't really realize how they should check for breast cancer.
Oh, yeah, like, we were just talking about, like, how men get it. Like, can men check the same way as women?
Pretty much. Best ways of doing it is when you're in the shower and when you're examining your chest. You make sure that you're going underneath the armpit, below, more towards the abdomen as well, not just the breast area. And what you're looking for are lumps, but not just normal lumps. They feel more like little pebbles in your skin, and it's a very distinct feeling.
Okay, so it's not going to be like, if it's something like a really distinctive squishy spot, it's not probably cancer.
Probably not, especially with women, because they have a lot of different lymph nodes and other glands in their chest.
Makes sense.
Plus, if you think anything might be in there that shouldn't be there, get a mammogram. It's a lot easier for guys than it is for women because guys don't have all that fleshy stuff right there.
Yeah. That would also probably mean that it's easier for the cancer to spread too, right? Since there's less tissue.
Pretty much.
Oh, okay.
Guys with breast cancer tend to die more frequently than women because the cancer can spread so much more rapidly.
All right.
I mean, with women, they can always cut off their boobs, which a lot of people are against, weirdly. But with guys, since there's not a lot there, it can spread a lot quicker and a lot easier.
Yeah.
So guys, you need to check. It's not just for women. This is a men health issue as well.
Don't have to be ashamed of it. I mean, if it's going to end up saving your life, then by all means, check. If you see something there, go for it. Go to the doctors.
So, do you know any other information?
Well, we pretty much hit on like the main things. 100 times less common for men. We can get mammograms.
Now, we found all of this on the American Cancer Association website.
Yeah, it's a cool place. Check it out.
A lot of great information, things that we might not know, you can find on there. So check it out.
Yeah, do your own research. I mean, the more you know, the more you can try to do.
And who knows, maybe that 5 minutes of research could end up saving your life.
Or someone you know. I mean, we all have people we care about. Ben was just talking about his mom, so.
So if you like what you see, next week, watch Amanda Katie. She'll be another host for the Sextant. And the week after that, you'll get to see us again.
Yeah.